It's a three-phase study. We're going to be working in one prison, in a high-security prison, working very closely with the staff, and what we're trying to do is develop what we're calling a transferable model of integrated end-of-life care. That's the ultimate goal of the study. In the first phase, we will be doing what we call a situation analysis, and what that means is we're going to be doing interviews, focus groups, and a small number of case studies with prisoners to really try and find out what is currently going on in that prison environment in terms of end-of-life care. And then in the second phase, we'll be moving into very intensive work with a small group of staff, initially just prison staff, healthcare staff, prison security staff, and then we will be including in a later part of that phase, we'll be including healthcare staff from outside of the prison, with the objective being to allow the staff to bring about change that they would like to bring to improve the provision of care. We're using a methodology called action research, which is a very participatory approach to doing research, whereby the staff, in this case it'll be prison staff, and the other staff who are involved, are the participants, active participants in the research. And the researcher, who will be going into the prison and working with them on a very close level, will act as a facilitator, and the staff will be in control of the areas that they want to make improvements to around their practice. So they will identify issues and potential problems, areas that they see as difficulties that they want to focus on. And they will, through a process of reflecting on any issues, planning changes and ways in which they could overcome those, implementing the changes, and then evaluating the effectiveness of those changes, improvements are made in practice. But the staff are very engaged in that process, and they will have ownership really of the way that the research goes. That's the sort of the central component of what we are doing. And we're going to be doing that with, as I said, with prison staff, so that's prison healthcare staff, nurses and so on, and also prison security staff. And we're going to bring particularly those two groups of staff together. And then in a later phase of the research, we will be bringing in staff from outside the prison, so from primary care and from specialist palliative care, and get them to work together with the prison staff again to make changes. And that's why we're calling the project Both Sides of the Fence, because we're working with staff both inside and outside of the prison. The ultimate goal of the project is to develop a model of care that can be transferred from the one prison that we're going to be working in out and have applicability right across the prison service. So we need it to be something that the prison staff and the people who are really involved in this feel will actually work. And we want it to therefore have a practical benefit for prisoners in the future who will be dying in the prison setting. One of the real advantages of action research is that change happens as you're going along, and it isn't a case of waiting to the very end of the project until you see any results, because the staff have ownership and are deciding the areas that they want to improve. Then they will see changes as they go along. So it is a fairly labour-intensive method in a sense, because the staff have to commit to really working on this with the researcher in a very close way. So the researcher will be in the prison quite a lot of the time, over a long period of time, and the staff will engage with the researcher very closely in discussions and reflections and planning and evaluating changes that they've made. So it's quite a big investment from the staff, but the staff from previous experience we know will probably be very happy to engage with it, because they'll be able to see quite immediate benefits, and it will actually make their jobs easier if things are more joined up. We're very grateful to Marie Curie Cancer Care for funding this research, which we see as a really important piece of research in an area that has been very little researched in the past. So I'm very confident that what we find out will be of real use across the prison service, and hopefully in improving end-of-life care for prisoners in the future.